For me, treating anxiety and treating pain, it often requires multiple modalities to address patients' concerns. There's been a strong push from my patients, especially in the opioid environment that we're in now, to try and look for alternatives that don't entail oral medications or medications in general. And a lot of patients are nervous to venture down the interventional pain route. In my fellowship and in my PM&R residency, I was lucky that I got exposed to Alpha-Stim, where I trained at the James Haley VA. It was a very prominent device that a lot of the therapists, the psychiatrists, psychologists, occupational therapists, physical therapists, they all kind of got educated on the device, and it was very well known just how beneficial the device could be. So when I transitioned from an intern to a resident, and I began making my rounds and working closely with the speech pathologists, the physical therapists, occupational therapists, I got to see this device used in practice, whether it be the aid or the M. It was quite effective at helping patients attend their therapy sessions, helping to keep their pain scores down, helping to reduce some of their anxieties and perseverations around anticipations and pains with their therapies. And so these therapists were able to really encourage patients and get their buy-in on attending these therapy sessions utilizing this device. When I transitioned out of commercial medicine into more acute pain and accident-related injuries, I was better able to incorporate it into my practice. There's kind of two ways that I currently utilize the Alpha-Stim device predominantly in my practice. One is really helping patients with a lot of the pre-procedure anxiety that they experience. They go through a lot of trauma when they're in these accidents. They have acute pain, and it can be very life-changing, and that causes a lot of anxiety for patients. And then being told that they have permanent injuries and lots of recovery time that they're going to have to go through therapy sessions, it can be kind of life-changing at first for these patients. Introducing them to the Alpha-Stim device and the ways that it can help to regulate some of these anxieties has been really helpful for me in my practice. So generally, even sometimes on the first consult, I will introduce this device to the patients. After we've kind of gone through their medical history, talked about things that they've performed and done to try and help with their current pain situation. We'll talk about a lot of the conservative things, whether it be non-addictive, non-habit forming medications, or the Alpha-Stim device to help with some of their generalized pains and the anxiety that they're experiencing, whether it be related to the trauma from the accident or their pain or just the unknown. So, in utilizing this device in that situation, a lot of times because it has very low risk, it has been very effective in my experience. The patients aren't having to take a medication. It has a convenient size, it's very transportable. The patients are very interested in that modality. And so, depending on the length of time that I have for that consultation, if the patient's very interested in trying it, we'll consent them for it and we'll place the device on them and let them try a therapy session for the 20 minutes that they're there, and then usually get a lot of positive feedback from it. Those patients that have really enjoyed the Alpha-Stim, we can prescribe the device for them to use at home to help out regularly whenever they're experiencing anxiety or pain flares to help reduce those symptoms. The other way that I utilize Alpha-Stim in my practice is really to help out with patients when we have them scheduled for interventional procedures and they're having a lot of significant pre-procedure anxiety, their blood pressure's up, they're sweating, they're not sure they want to do the procedure. You can kind of come in there, talk to them, re-go over the procedure, the benefits and risks, and then we'll allow them to utilize the Alpha-Stim device. We'll place it on their ears, turn it on, kind of let them relax for a few minutes, and that device has a very comforting response. It helps to reduce a lot of that pre-procedure anxiety, and they feel a little more comfortable proceeding on with the intervention. And it's allowed me to reduce a lot of my, Valium prescriptions or having to take patients to the surgery center so they can have monitored anesthesia care prior to these procedures, just because of the level of anxiety that they're experiencing. And this device has been really helpful from that standpoint. Some patients who remain anxious throughout the procedure, we'll let them wear the device because it's out of the way. It's not going to be affected at all by the fluoroscopy. Again, like I said, it has a very calming nature. It has been beneficial throughout to try and help with both the anxiety related to the procedure, pain experienced during the procedure, and the patient's overall well being, even after the procedure.